Today, we take you to hear a success story in curing malignant cancer. A 6-year-old boy was diagnosed with a rare cancerous tumor in his face known as spindle cell sarcoma. A hospital utilized 3D printing to map out his facial bones in an innovative treatment that they had never tried before. This technique allowed doctors to perform minimally invasive surgery on his eyelids and mouth, reducing scarring. FTV reporter Stephanie Yang has the details.
6-year-old Chen began to suffer from facial asymmetry 6 months ago. Although he had no symptoms of pain or numbness, a medical examination revealed he had a malignant tumor with a diameter of 1.7 centimeters on his right cheekbone. He was diagnosed with a rare cancer called spindle cell sarcoma.
At that time, I knew something was wrong because his whole face was very swollen. Then he got his diagnosis. Of course, it was devastating. It felt like falling from heaven to hell. And then we heard this on his birthday.
To accurately remove the tumor, the medical team used 3D printing to recreate the bones on his face, putting them together just like a puzzle to locate the surgical site. Then they performed minimal invasive surgery on his eyelids and mouth to reduce scarring. The doctors also utilized liquid nitrogen to freeze and kill the cancer cells.
Using the 3D printout as a guide, we determined the position and we placed it on the patient's bone during the operation and then made precise cuts. For the bones containing tumors, we first dug out the tumor in the middle. Then, of course, there were some remaining tumor cells. We used liquid nitrogen to freeze it to kill the cancer cells and then transplanted the bone tissue back into the patient's body.
Wang Tianxiang, a doctor with Taipei Veterans General Hospital, says it would have been much harder to treat the child if the diagnosis was made later in his life. Fortunately, Chen has now recovered and will be celebrating his 7th birthday soon. FTV reporter Stephanie Yang and Hu Cheng'en in Taipei.